What's CPR? CPR is termed cardiopulmonary resuscitation. But there are casualties who we give CPR on. Not all casualties who collapse that way that will give CPR. When a casualty goes unconscious, two things happen. Either the casualty is unconscious breathing or is unconscious not breathing. And we are not going to compress anybody who is unconscious still breathing. You rather place such a person in recovery position. This cardio means the heart system. Pulmonary means the lungs or the respiratory system. And then resuscitation means revival. So when a casualty goes unconscious and is not breathing, the next thing a first aider will need to do is to compress the chest up to 30 times and give what we call the rescue breath. We are taking an adult for today, adult CPR for today. How do you give an adult CPR? We always tell you, you go close to the casualty. And what does compression is the heel of the palm, not this part of the palm. We always use the heel to compress an adult. And what you compress is the center of the chest. So you go at the center this way, and then you lock up your hand this way to compress. Always make sure your hands are free when giving CPR. Ensure the airway is open. In 1 minute, you have to compress this chest up to 100 to 20 chest compressions. So to achieve an average of 90, at least in 20 seconds, you have to hit the heart up to 30 times. So it means in 1 second, you have to hit the heart twice to do that. The best way to get the rate is, usually we have one of our Nigerian artists, Kiss Daniel, who has a song. At a point, you'll be hearing twerk, 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 twerk. So if you can not remember the rate of compression, you can actually remember twerk, 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 which is the rate at which you have to go on a casualty's chest to achieve good compression. How do you do that? I'm using 2 hands to compress an adult. Though in children we use 1 hand and in infants we use 2 fingers. How do you do that? Go with this hand and then lock it up with the other hand. Ensure you are compressing at the center of the chest. Get the center with the heel there and then lock it up. Do not go far compressing this casualty, because if you do this, you'll be stressing your spine. So always go closer to the casualty and then push in your body to the casualty. Make sure your joints are locked while doing that, and then you compress up to 30 times this way. 30. And once it reaches 30, you have to introduce what we call rescue breath, kiss of life, or what some people term mouth-to-mouth respiration. When the air is given, you quickly check again if there's any response. If there's no response, you repeat sequence until when help arrives. I always advise you, when compressing the casualty, always look at the body from the head to the toe, from the toe back to the head, to see if a casualty can give you any sign from any body part. It means once you are compressing and there's a response from the casualty, you're expected to stop.